destruction of all the hair follicles in the area, in the scarred area. Of course, the most common cause of hair loss is the androgenic alopecia, which affects both males and females, but occurrence in males is at a different and earlier age than females, as well as the pattern of hair recession is different among them. We have a condition which is after practicing hair transplantation for several years now, that is very common and called telogen effluvium, which in common words we call diffuse hair thinning. Usually the number of hair is not affected, but there is thinning of the whole set of hair, and it gives an effect of hair loss. Ophiasis is a form of alopecia that comes from the Greek word ophis, which means serpent. It affects the edge of the hairline, both in the back and the front, and it is a bit wavy and takes the form of a serpent. We all heard about the alopecia areata, which is spotty. Usually with treatment is reversible, but if the treatment is delayed or if it comes in severe form, it progresses to alopecia totalis, in which there is loss of all hair in the scalp, in the eyebrows, and a further condition called alopecia universalis, where the whole body hair is lost. This is a very hypothyroidism, of course. We all heard about it, that it causes loss of hair in the temporal area and in the lateral third of the eyebrows. A very common form, although neglected, not looked upon, is the traction alopecia. Due to certain hairstyles, there is traction on the hair roots, especially in the frontal foreline, and this causes the death of the follicle, and hair transplantation is a line of treatment for this type of alopecia. Polycystic ovarian syndrome with its hormonal disturbances. And last but not least is the post-bariatric surgery. Recently, after the increased number of post-bariatric patients, it was discovered that some patients suffer from hair loss after their post-bariatric surgery. What are the causes of post-bariatric hair loss? Surgical stress, as in any type of surgery, leads to activation of the sympathetic system and its known effect on hair follicles. There is, of course, a hormonal disruption, especially in the anabolic phase, in the post-operative anabolic phase, where there is a decrease in testosterone and androgenic hormones, and this also is an important factor, as it is a factor in the androgenic alopecia hair loss. The acute weight loss leads to loss of the function of the hair follicles, and is one of the causes. In some persons who are poorly managed post-operatively, we find protein-calorie malnutrition, and we have found this even in our plastic surgery practice, where we do, for instance, an abdominoplasty, a breast reduction, or any type of surgery following the post-bariatric phase. In the post-bariatric phase, in some patients, we really suffer from wound healing due to this protein-calorie malnutrition. Iron deficiency, of course, is the main cause of hair loss. And finally, zinc deficiency, which affects both hair and skin. When to raise suspicion that the patient has a post-bariatric hair loss. If the hair loss started more than 6 months after surgery, when the patient has had difficulty eating and or has not completed with combined with supplementation. And you all know that supplementation is mandatory after any bariatric surgery. When the patient has demonstrated, as we mentioned before, low values of protein, ferritin, or zinc. As we mentioned also before, when he loses weight in a very short period of time, and when other symptoms of deficiency are present. The problem now for hair transplant surgeons in post-bariatric patients, is it a case of temporary post-bariatric hair loss due to all the causes we mentioned, or is it a cause of real androgenic alopecia, especially that younger patients are undergoing these surgeries now? Or is it a combination of both? How do we detect this? In our DHI clinic in Egypt and all over the world, actually, in all DHI clinics all over the world, we conduct what we call the DHI alopecia test. It's a very informative test that gives us valuable information in so many points. What are the advantages of the alopecia test? Before talking about the advantages, I'd like to put an emphasis on what determines the health of the hair and what determines the success of the hair transplantation. It's the donor hair. It has nothing to do with the area, with the scalp area where the hair is lost. It's the condition of the donor hair and the number of hair in the donor area that allows us to determine the diagnosis, the right lines of treatment, as we'll see briefly here. It determines the type and cause of alopecia. How do we determine the type and cause of alopecia? If a patient, whether post-bariatric or a normal patient, comes to us and he wants to know whether the alopecia he has is androgenic or otherwise, we start by measuring with special cameras and special software the hair in the donor area. We get several parameters. First, the density of hair, which is below a certain number, the patient is then not a candidate for hair transplantation. Most important in this matter is that we can know the hair is in which growth phase. Is it in the anagen or telogen phase? And this depends upon measuring the diameter of each hair in the donor area. If the majority of hair in the donor area is in the anagen phase of the hair cycle, this means that the patient's hair is healthy and we can assure that his condition loss in the post-bariatric period. If we find a cause, we start by treating it and then we measure the cycle in the donor area. If it returns to normal, that means that we cured the patient. If it returns to normal only in the donor area, it means that the patient had both a post-bariatric element and an androgenic element of his alopecia. We grade the type of hair loss. As I said, we measure the hair density in the hair site. And finally, we can assess with our DHI test the number of hair or the hair bank the patient has throughout his lifetime available for transplantation without affecting the donor area. And this is very important because if the patient, for instance, needs 1,000 grafts and he has 2,000 donors, we have no problem. But if the opposite is there, if he needs 2,000 grafts and he has only 1,000 good donors, then we have to plan very accurately how to best use the grafts he has to give a proper density in a given area. And we can also, through this test, measure the number of hair needed in the recipient site. PRP treatment is a valuable option. You have all heard, I guess, about the PRP treatment in different fields of medicine. But one of the most advantageous fields for post-bariatric patients is the plasma-rich platelets treatment, where we separate the plasma rich in platelets, we re-inject it into the scalp of the patient, to inject a high concentration of platelets, which are considered, as I say, a factory of growth factors. It injects growth factors into the hair follicles and makes them behave in a healthier way. Success rate of the DHI technique after 4 years of being present in Egypt is over 90%, which means that we promise the patient that out of each 100 hairs that we implant, 90 at least will survive. This is a written warranty, not an oral one. Why do we reach this rate? Because the DHI alopecia test allows us to select very properly the patients who undergo the transplantation. Secondly, because we have an international patency of an implanter used only in DHI. It has several advantages, but the most important of them is that we guarantee the placement of all the follicles at exactly the same level immediately under the surface of the skin to improve our results. We'll show you some of the results we have had. This is a frontal and occipital area grafting. This is an advancement of the hairline and temporal area. This is a post-bariatric patient, an Egyptian living in Canada, who tried to do his hair transplantation in Canada, but they were a bit worried about the thinning of his hair in the post-bariatric. He came to us. We used a few sessions of PRP treatment on the donor area, and then we actually 3 sessions over a 2 months period, and then we were quite confident to do him the grafting, and this is what we got with him. This is a 1 month post-operative picture to show how it looks like after using the implanter, the DHI implanter. This is 12 months post-operative. This is another patient with the frontal, what we call the A and B zone implantation. This is a temporal recession patient. This is an advancement of the hairline and temporal area. Thank you very much.